going on, guys? Welcome back to my channel. First off, I do want to start by just apologizing for not being as I don't know, like frequent in vlogging as I initially thought I would be. Some unexpected health issues came up. Although I've been experiencing health issues with this particular condition that I do have for about 4 years now, for some reason it's been definitely getting a lot harder, and the symptoms have been getting more frequent or worse. And actually that's what this video is basically going to be about today. So we're gonna start by talking about my diagnosis with hyperthyroidism. So I was actually diagnosed with hyperthyroidism 4 years ago, so back in 2014, and it was around the summertime. Not quite sure what month, but I would say if I had to take a guess, it'd be June or July. And I had no idea. Sorry you guys, like honestly, there's just so much to talk about when it comes to hyperthyroidism, and I guess the whole reason why I am talking about it or exposing myself and telling you about my condition is just to bring awareness to anybody, not just females but males as well, about the condition. So my story begins, as I said, 4 years ago, when actually the first sign that I experienced was when my boyfriend at the time and I ended up moving into an apartment in the city, and he had actually left town for the weekend to go visit a relative, and I ended up staying behind just to sort things out and like make sure that everything was clean, everything was set up for when he got back home. And what happened was we were painting the apartment and like making sure that there was like no dust anywhere, nothing, and like just completely like redoing the place and just getting it like homey. And I ended up breaking out in like the craziest, mind you, this has never happened to me before, in the craziest hives, and which I thought it was hives. So it was like a huge like rash all over my body. The itching was horrible. Swelling mostly like in my neck area, face and ears. And my mom and I actually used to joke about the fact that like when I called her that day to let her know that something was wrong and like something was happening, when she ended up coming, which mind you, she lives at the time she lived out of town, so about an hour or so away from the city, she literally ended up racing down to my apartment. When she saw me, she literally freaked out, and I was a little bit freaked out because from what we knew at the time, and still up until this day, we have no, I have no history of any type of like allergic reactions or like any type of allergy. And so when she saw me, she's like, holy crap, you look like Fiona from Shrek. Like, it was funny at the time, and actually it really still is, I'm not gonna lie to you, but we didn't realize how serious the problem was. So what we ended up doing is we pretty much had a good idea that the symptoms I was experiencing coincided with allergies. So we ended up going to the pharmacy as opposed to the doctor's office, and I'm pretty sure it was a weekend, and like I lived in Toronto at the time, and I didn't want to stay in line for hours upon hours upon hours at a walk-in clinic because my doctor was closed on, I think it was a Saturday. Anywho. So he was closed and he wasn't there, so I knew automatically what they would do is, because it is a walk-in clinic, there's only so much that they can do, and like they don't have my family history of any sort, so they would pretty much just give me some type of medication or prescription, whatever, and bring me home. So we ended up skipping on that and just going straight to the pharmacy. When we got there, we explained my symptoms to the pharmacist. Obviously, like they saw me, like they have had an inkling that I was going through an allergic reaction as well, because I had no prior family history of any type of disorder or disease at the time. And so like they recommended Benadryl, so great, whatever, we took it, went home. My mom obviously stayed over for the night, and I took the Benadryl. So the next day, my symptoms were getting better. I wasn't like 100% yet, and gosh, like I'm just like remembering this and it's so crazy. So anyways, the symptoms gradually started getting better as like the weekend progressed. And so we thought, okay, cool, like the Benadryl's working, it wasn't an allergic reaction, that's crazy. What do you think you're allergic to? And so we're like inspecting the place, and I've never had like any type of allergic reaction to dust or anything like that. So we automatically excluded that from what the possibilities were. And then we're like, okay, you know what? Like we haven't done much painting in the past, so maybe I'm allergic to something in the paint that we were using. So, okay, cool, whatever. So the next time I experienced the symptoms of what we know now is hyperthyroidism, is actually like, and this was in the same place too. These things started happening very close together within the time period. And I started noticing swelling in my ankles, and I thought that was like so incredibly weird because I've never been overweight. Actually, well, I've been losing weight now because I've been like changing what I'm eating now. So like I can't say like this is the heaviest I've been. I've been pretty heavy, and this was like actually back in January, this January, but we're not gonna get into that. Not in this vlog anyway. But so yeah, I was never like overweight or anything, and diabetes does run in my family. However, we didn't think it was anything. Sorry, my voice like going in and out, but we didn't think it was anything related to diabetes. And I didn't really speak to my mom about this because I didn't really understand the seriousness of the ankle swelling or what symptoms that it could be representing and whatnot, or underlying condition. So I let that one go, but it was like a very constant thing where my ankles would swell. Anyways, at this time, back in 2014/2013, I was working a retail job, and so what was happening was that it was very like high pressure, very sales driven, amazing job by the way. So I'm just gonna put it out there. I was working for Banana Republic, like best retail job I've ever had. And so I was doing fairly well, and they ended up moving me to Fits, so which was like closing the sale in the fitness department. So sorry, fitness department, oh my god, in the like changing rooms. So like I was constantly on my feet and running around and blah blah blah. And then I started noticing that within a month's time, you guys, I kid you not, and I wish I was, within a month's time, I actually lost close to 30 pounds 1 month, okay? So, and I actually have some pictures on my Instagram, which I guess I will put down here or here or here or here, whatever, here. And you guys can just go check those out. So 2014, like how much weight I lost in such a short period of time. But I related that to the fact that I was working such a high-paced job, and pretty much the fact that like I wasn't eating as much and blah 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 blah. But never ever did I guess it had something to do with hyperthyroidism. So a crazy opportunity came about where in 2014 I actually ended up leaving Banana Republic. It was really sad. I really enjoyed that job, but for bigger and better things. And so I ended up getting a job in the healthcare sector, and not exactly what I went to school for. Went to school for law, but you know what? Like, it's a higher paying job, better hours, more experience, so I ended up taking it. Anyways, so I get to that job and start working there for about a few months, 2 or 3 months in like the site where I was training at. And I ended up getting transferred to my home site, which was in Mississauga. And so when I get to Mississauga, oh, by the way, okay, we'll keep going. So I'm telling you guys, within the 4 years, I've experienced so much, but we'll get to that gradually if I can, because I tend to get off track because there's a lot to say. But anyway, so I get to Mississauga, and the symptoms are not so crazy like the way that they were when I was working at Banana Republic. Like the swelling in my ankles didn't, like, nothing crazy came out of that, and they started to, like, that started to go away within time, and to the point where it was like non-existent. And so I was really happy, and I'm like, okay, cool, like, yeah, maybe this has a lot to do with the fact that I was like constantly on my feet or running around, blah blah blah. So like, I would go home, everything was normal, but I did notice one thing, and that was like I constantly had hand tremors. But I thought it was because, like, I don't know, I was under a lot of pressure at the time. I was going through some crazy anxiety, which at Banana Republic, I was also going through a crazy amount of anxiety where literally, you guys, I kid you not, I would have such crazy anxiety attacks that I would have to excuse myself, like, tell them that I'm stepping off the floor, go into the washroom, and this sounds really psycho, but like, anybody who has anxiety issues, you guys can relate. Like, I would step off the floor, go into the washroom, and just like scream, like literally, but in my hands, not so everybody can hear like a freaking lunatic, but I would have to like scream and just get all of that anxiety out somehow, and like just take a breather, cry. Like, honestly, I would just like cry for a couple of seconds, and then all of a sudden I get up like nothing had happened and go back on the floor and do my thing. Like, my anxiety has been so crazy with this condition. Like, anyways, so that's another thing. So that kept persisting as I was working at my new job. And so that would happen. I would go home at night, of course, like, get ready to start the next day. I would shower, and I would notice like crazy, I'm talking crazy. I'm lucky because, like, I have a shit ton of hair. Like, I have a lot of hair, and very thick hair too. So anyways, a shit ton of hair would fall off my head as I'm shampooing. And I was experiencing that for a while, but not to that extent, right? So I didn't really think too much of it. I was just like, oh, it's okay. Like, being so naive and like so young, I'm like, it's okay. It's just because, like, I'm shedding right now, and my hair is probably just getting ready to grow some more new strands. Something stupid. I don't even know what my thought process really was. But anyways, but as time proceeded, it continued happening, and more and more and more and more and more. And I'm just like, okay, cool. Now I'm getting worried. So one day I actually went into work, and there's a colleague of mine who used to be a radiologist, so a doctor for like MRI and like CT scans and ultrasound, so anything imaging. He used to be a doctor in China, and he used to I guess also perform surgeries as well. So he specialized in radiology, but he would perform surgeries as well. And he takes one look at me, you guys, and I kid you not, he takes a look at me, he's like up and down, and he's like, you need to go see a doctor right now. I think you have thyroid problems. And I'm like, okay, that's really interesting of you to say. Like, at this point, I did know him for about 3 or 4 months, so like, cool, we were cool in a way. But I was just like, what a funny thing for somebody to say to someone. And I'm just like, but you know what? I'll take that advice, because I've been having some weird symptoms. And at that time, I kid you not, I did not have any idea of what the hell he was talking about. I didn't even know what a freaking thyroid was, okay? And for those of you who don't know, don't be ashamed of it. Like, unless you're going through something that's health related, and like a lot of people don't know what a pancreas is, or like medical things like that, like organs, anatomy, whatever. But for those of you who don't know, it's a gland right in here, It's butterfly shape and, oh sorry, it's butterfly shaped, and it's just right here, and it controls like literally every function in your body. It distributes hormones, and which regulates, like for women, like our menstrual cycles, it's just like it distributes hormones. So what I have is hyperthyroidism. There's two types of thyroid diseases, hypo and hyper. So hyper causes you to experience the symptoms that I was experiencing, which is like the tremors, anxiety, heart palpitations is a huge thing for me. And I did notice during that period of time, as I'm looking back now, that sweating. But anyways, I used to experience like chest pains, and I would ignore them. Honestly, you guys, I don't know what I was thinking, but yeah, I would ignore these things. So so it's an irregular heartbeat. And so your thyroid essentially like takes care of all that. And what my thyroid was doing was it is overproducing T3s and T4s. So those are the two types of hormones that your body produces in order to keep everything running smoothly. And so because of that, I always felt like restless. And I didn't really have problems sleeping, although I had loads and loads and loads of energy like all the time. And it also caused me to sweat and have like hot flashes, and it still does. And so anyways, if you guys are experiencing any of the symptoms that I'm talking to you about, some people just like honestly think, oh, it's okay, I just have anxiety problems. Oh, it's okay, like this and that, whatever. You guys, please, please, please don't be ignorant the way I was, or careless, or just like, you know, just push things aside, because these things are very serious. Go check out your T3s and T4 levels, because this can be very detrimental. If these two types of autoimmune diseases don't go untreated, like if they go untreated, it can cause congestive heart failure, and obviously, which could be fatal. Anyways, so I ended up taking my colleague's advice, and I ended up going to get my thyroid checked out, or my blood levels. And I had there's a doctor I was none too pleased with at the time. He was my family doctor for like what seemed like eons. And I ended up grabbing all of my patient history, patient reports, patient whatever, and transferring it to a doctor that was very like literally steps away from my new job. So I went to go get my thyroid levels checked out, and believe it or not, here we are, like with the same symptoms today, 4 years later, I get diagnosed with hyperthyroidism. And oh my God, there's my voice again. Hold on, give me 2 seconds. I think I need some coffee. Well, this is decaf because of course I'm not allowed like actual coffee anymore because of like the heart issues that I'm going to talk to you guys about. Anyways, so the new doctor that I ended up seeing, and I'm still with now, is actually my family doctor, and he was so diligent and so careful, and so like he did his job really well. And so what he did is as soon as they got that blood test, the results for it, he called me and he said, you need to come see me right away. Just walk in, don't worry about an appointment. Tell my receptionist that like you're there to see me and it's urgent. So I ended up going, and he sat me down and he explained to me what I had. And so hyperthyroidism can be caused by a couple of things. One of them is it can be hereditary, which from what we have asked lots of members from our family, both sides, no one has hyperthyroidism. However, one person, who was very close to me, was diagnosed with hypothyroidism, which is the most common thyroid problem. But anyways, so we ruled out, okay, cool, it's not hereditary, not when it comes to my problem anyway. Or it can be caused by Graves' disease, which is a whole other thing. But like Graves' disease causes like your eyes to like bulge out, and like you guys can do the research on that because that will be a whole different video. But like thank God like the Graves' disease hasn't done that to me yet. But anyways, so yeah, so then we find out I have Graves' disease. And so that's why I have hyperthyroidism disease. And actually, here's a fun fact is I just found out a couple of weeks ago that I'm an O negative, which is one of the rarest blood types, and it's a universal blood type. And so I can give blood to whoever needs it, but I can only get blood if I ever needed like a blood transfusion or anything from an O negative donor. And one thing I did, so I was starting to do research on this blood type, and with this blood type, there are thyroid issues. So like, they kind of like coincide, coexist, whatever. But again, that's a whole nother video. Anyways, so this doctor of mine ended up referring me to a endocrinologist who is amazing, by the way. Her name, I don't know if I should disclose it or not, but we'll just keep it at a specialist for now. And she was also very diligent, very caring, like very, you know, on top of her stuff. And she made sure that I got on the medication that I need, or medications. And like I would have a checkup with her every month. I had like for 4 years now, like every few months I've been seeing her. For 4 years now, every month I have like a blood work done to check on the T3s and T4s. And unfortunately, because we can get my thyroid under control, although we've tried, and normally what she was telling me is you try for about a year, and in my, I don't know, we try for about a year to get stuff just like to smooth things out, whatever. Anyways, so I'm such a dork today. Anyways, I can't talk. But yeah, so essentially you try for a year, and if that doesn't work, then you look at other alternatives. So what's happening now is because my husband and I have been very adamant about, you know what, like it's maybe time to start looking into starting our own family. We decided that our best route would be, so there were two things that two options my endocrinologist gave me. One of them was the iodine pill, which you take, it's radioactive, so you have to be quarantined, like you can't use the same washroom as anyone, you have to be secluded to like a room like by yourself all the time until the iodine pill or like the radioactive components of it is completely out of your system. But it's a non-surgical approach to getting rid of your thyroid gland. And so you take the pill and it literally like destroys it. However, there are some crazy symptoms that come along with that. So like premenopause can cause leukemia, can cause like a permanent like hoarse voice, which I really didn't want to experience. However, like the other option also does that. But I mean, leukemia is literally like a little too serious for me, and I didn't want to flex with that, so I'm just like, okay. She was also telling me about some patients experience like their tear ducts get messed up, and like they can't cry, or they cry, I don't know, just like some crazy stuff. But you guys can do your research on that if you're interested anyway. So I said maybe not to the iodine, because like, okay, I would like to have a little bit of free time before I start trying to have a baby kind of thing. And the fact that like it causes premenopause is just like crazy scary to me, because I don't even know how many children I want, but I want the freedom to be able to, you know, decide how many children I want, the amount of time that I have to have them, and blah, 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 so on and so forth. So, the other, I guess the other option was to get it surgically removed. Yay! Which is terrifying to me because of so many things. One, because I've never gone through surgery before. 2, you're under general anesthesia and that shit cray. Just because I'm a control freak and I always tell everybody this, I like to be in control. Like, I hate needles, but every month I go and I get my blood work done. But as long as I'm like looking at the procedure being done, I feel like I'm in control and like I'm fine with it. But the fact that you get put under general anesthesia, you can't really feel, like not feel, but you're not there, constantly there. That's scary to me, you know? And then of course all the pain you experience after getting your stitches removed and all this stuff, and it's just like, okay, cool. Like, you want to start a family, you want to get better, you want the Graves' disease to go away, this is your other option. So that's the option I'm taking. And so now I literally have, hold on, so today is, I have 4 more days until this said surgery, and I'm feeling so overwhelmed and I'm gonna start crying. Sorry. Anyways. Wow, that's weird. Anyways, so I'm feeling like extremely overwhelmed, and I just know it has to be done though. And of course there are so many risks that come with it. My initial, oh my gosh, do I need a tissue? Anyways, so my initial surgery date was supposed to be on the 7th of August, and that didn't happen because the doctor and the anesthesiologist, the head anesthesiologist, ended up turning me away because my heart rate was way too rapid, and there are some concerns when it comes to performing a surgery like that. My gosh, I'm so embarrassed that I started crying like that. But like, this stuff's real, so it's just like real life, you know? Anyways, so they ended up turning me away. My heart rate was way too high, and it's been way too high. It's just like, I can't feel it anymore, because can you imagine, like, this is what I've been going through for 4 years. So it's just like I've become like immune to it almost. Like, I can't feel chest pains as much anymore, like here or there. I can't feel when my heart's racing. So like, to me, it was all like, you know, normal. But then they started telling me that like they're scared because essentially what's gonna happen is when they're removing this gland out of my throat, they're gonna be massaging the hormones, the leftover hormones, into my system. And so that's gonna cause a spike in my heart rate. And the anesthesiologist was saying that there's no way that they're gonna put me on an operating table with my heart being in such a condition. And so that they're essentially scared because it's a liability suit waiting to happen. I'm not gonna, like, let's not sugarcoat it. And then another thing is, like, it may cause a fatality. And so I ended up being sent home. They gave me atenolol. It's a beta blocker, and what that does is just like, it slows down your heart rate. And since I've been taking that, I've been taking it for about a week. Yeah, a week now, almost. It will be a week as of Tuesday. And so I got put on 25 milligrams, and then they suggested for the first 3 days, and then they suggested to up the dose to 50 milligrams. So once a day. And so that's where we are today. They ended up rescheduling my surgery for the 14th of September, so 7 days later. And this time they're not gonna turn me back. And that's what everyone's been saying. So I don't know whether to be concerned about that, because if my heart rate is still like the way that it is, do I want a procedure like that to be conducted on me? Or is it that you're not going to be turned away because your heart would be good, or should be good at that amount of time? But anyways, you guys, I just wanted to share this with you. I will be sharing my pre-op and my post-op with you as well. And I just honestly really urge you to, if you're experiencing any of these symptoms, please go and see a doctor. It doesn't cost you anything. Just go get your blood work done, and it could possibly save your life. So with my, just to break it down quickly, these are the symptoms to look at. Okay, sorry about that. So my camera shut off for a second. So anyways, these are the symptoms, you guys. If you are experiencing hyperthyroidism, or you could be, this is what to look out for. So fatigue or muscle weakness. I was experiencing not fatigue up until lately because of the new medication that I've been put on. Hand tremors, that was a crazy thing for me. Mood swings, absolutely. That was a big thing as well. Nervousness or anxiety, don't brush off your symptoms. It can be something more like serious than just plain anxiety, you guys. So go get that checked out. Rapid heartbeat, that's me as well. Heart palpitations or irregular heartbeat, that's me. Skin dryness, I never really had problems with that. Trouble sleeping, not until lately. Weight loss, absolutely, that was me. Increased frequency of bowel movements, I know, like TMI, but like could lead to something more serious, like a more an underlining like condition, or light periods or skipping periods, and I'm not gonna get into that with me, but anyways, yeah, so I urge you to please go see your doctor, get your blood work done, and it could possibly save your life, as I was saying. And another thing is, although I didn't really touch on hypothyroidism, the symptoms are a little bit different, but there are some similarities. I do ask that you go and get that checked out as well, because that also causes congestive heart failure if it is untreated. And I guess that's all I really wanted to say. I may be missing so much, but honestly, I'm feeling kind of emotional right now. I don't, like, this video was a lot longer than I anticipated it to be, as usual, because I talk too much, but I really wanted to get it out there. I really wanted you guys to know what to look out for. I wanted to, I guess, share with you what I've been experiencing, and just spread awareness. Anyways, you guys, until then, take care of yourselves, take care of each other, and much love from me, and we will touch base again soon. Bye.